Hello, everyone. We are going live today with Dr. Tara Brown. This is Breast Cancer Awareness Month, and we'll be hearing from a physician who has been challenged and with this and how she has dealt with it. So this is going to be some really good information. All right, I think she's here. Let's see.
Hi,
Welcome.
thank you.
Welcome. Well, everyone, we have with us today Dr. Tara Brown. She's been a practicing physician for the last 15 years. She has her aesthetic practice in La Jolla, California. And we just are really grateful to have you on, Dr. Brown, to share with us your experience on going through this very challenging thing that so many women face. I think I was looking this up prior to our call, but there's actually 1 in 8 women who will be diagnosed with breast cancer sometime in their life. I think they're expecting 281,000 new cases of invasive breast cancer this year, and another 49,000 cases of non-invasive. So this is something that we really need to talk about. I'm glad we have a time. This month is really dedicated to talking about breast cancer awareness and helping women to stay informed and to be prepared. Because so if we're not facing it, we're going to know someone who has. So I just appreciate you coming on. For those of you who don't know, I'm Lana Kerr. I'm the CEO of Lumis Skincare and the founder and CEO of Lumis Skincare. And Dr. Tara Brown, as a physician, she uses it in her practice, but today she'll be sharing with us her story. So Dr. Brown, let's get into it. So thanks again for coming on.
Happy to be here.
Very good. So then tell me something. How did you discover that, or first of all, when were you diagnosed?
Christmas 2020. So Merry Christmas to me.
Oh, wow. So tell me, how were you diagnosed? What happened? How did you find out?
I found a grape in my armpit in the shower, which was a lymph node spread. So it had already spread to my lymph nodes. I had had a negative mammogram the year before, but it was also noted that I have dense breast tissue. And in those cases, sometimes the mammograms can't pick it up because the average breast cancer has been there for 7 years before it's diagnosed. They're typically slow growing. But I wasn't aware of it, unfortunately, until it had already spread.
So you were in the habit of getting yearly mammograms?
Right.
Yes. And the year before, in 2019, it was negative.
Correct.
Okay, so then it's a good thing that you were in the shower feeling, we're always taught to kind of examine ourselves.
Just honestly not even feeling, I was just washing myself like normal. And at the breast care clinic, the nurse said, "I'm surprised you found this lymph node because it's really small." And so she couldn't really palpate anything in the breast because the mass in the breast was really, really tiny. It just happened to be, I think, in the upper outer quadrant where they're just more likely to get on the freeway and go straight into your lymphatics, into the armpit.
Wow. So tell me something. What made you found this, what made you just go right away to check this out?
That's a good question. And it didn't feel like a metastatic lymph node to me either because it wasn't matted. It was actually super mobile, like moved around, and they're usually not. And in fact, in the breast care clinic, the nurse whose job is to feel boobies all day long, she said, "This doesn't feel like a metastatic lymph node either, but I don't have a reason for it, so I'll just go ahead and send you for an ultrasound." So then during the ultrasound, the doctor, I knew immediately what I had. I could tell by the look on her face. So she said, "I need to biopsy this right now." And I knew. So when I got the call the next day from the pathologist saying it was invasive ductal carcinoma that had already spread, to at least 4 lymph nodes, I wasn't surprised. I mean, it's hard to explain what it was like to hear those words. We were actually about to get on a plane. I got the call just as we were about to get on a plane in 3 hours for a flight to Cancun for the kids, you know, Christmas break and everything. And so they connected me with an oncologist who said, nothing is going to happen at Kaiser over Christmas. So probably not even New Year's. So if you had a trip scheduled, go ahead and go, because it's not like you'll be starting any treatment or get a PET scan or anything. So my husband looks at me and he's like, it's up to you. I mean, do you want to still go? I mean, we were all, you know, on the floor and crying. And I said, yes, let's still go, because me laying in bed for the next week isn't going to help anything. So I'm really glad we did, because I mean, we didn't know at that point if I had stage 2, stage 4. I have stage 3, by the way. But the next day, you know, I speared a lobster 30 feet down. I jumped off a waterfall. So, you know, I am really glad that we went on that trip. And then when I got back, I started chemo the next week.
Wow. You know, when we met for lunch some time back now, one of the things that has impressed me about you, and even seeing your posts and seeing your attitude, you have such a powerful attitude. I'm so impressed just with going through all of this, and your attitude going into this is so encouraging, you know? And by the way, for those of you who are just joining, I'm speaking with Dr. Tara Brown, and thank you all for joining. She is a practicing physician in La Jolla. She has an aesthetic practice. And we're talking about her experience in 2020.
Yeah,
2020 was diagnosed with stage 3 breast cancer. And although she looks like she's 12 years old, she is a mother of 2, and she's been married. How long have you been married for?
18 years yesterday.
Oh my gosh. Well, happy anniversary. Happy anniversary.
Thank you.
18 years is an accomplishment. And you have how many children, and what are their ages?
I have a 14-year-old son and a 10-year-old daughter.
Yes. Okay. So she is a vast knowledge of information. Even friends going through this, talking with her. For those of you who are listening, will get a lot of information you can help yourself and share with your friend, because this is something that's very prevalent. As we talked about before, you know, over 281,000 women will be diagnosed this year, or expected to be diagnosed this year, of invasive breast cancer. So thanks again. So as we were talking, she discovered she had a negative mammogram the year before. She's attributing that maybe to her dense breast tissue, but she was in the shower doing an exam. She found it, and then over Christmas, she got the news. Wow. So Tara, what was next? So you came back. Tell me what's your course of treatment.
So on January 8th, I started chemo. It was a 5-month course with 3 different drugs that my oncologist said was the worst. And it was bad. I got a port put in my chest because the treatments were every week or every 2 weeks. And then I had surgery. I had a bilateral mastectomy with lymph node, with axillary dissection with 24 lymph nodes removed. That was on June 17th. And then about a month after that, I did 25 rounds of radiation to the whole, like basically this chain of lymph nodes around the collarbone, straight down into the internal mammaries, off the base of my ribs, and then all the way up, including this whole, it's a huge area.
Wow. How has that affected you? How has that affected?
The chemo was hard because it made me so tired and very, very nauseated, neuropathy, you know, the usual things you hear about chemo. The surgery was tough because with the chemo, I had to give myself injections every day because I had practically 0 white cells, which happens. So these are bone marrow stimulating shots. So you'd have basically some white cells, so you wouldn't have to live in a bubble. And I went into surgery with very few white cells. So I got an infection on one side that took a while to clear up. I had to get the wound debrided. And then once I got over that, you know, I started radiation, and it can take months for your white cells to come back. And the radiation, they're looking to get the skin burned. I mean, from the radiation oncologist would check my skin and say, it's not red enough. It's not red enough. So by the end, I mean, her eyes were big and she was like, oh, okay. 'Cause I had charred, sorry to be graphic, everybody, but I mean, it was charred 3rd-degree burns, and then it was so tight because it contracts, the skin would split and then bleed. And this is on, you know, post-surgical skin, the wounds opened up and everything. So I used the CO2 Lift mask, the CO2 Lift Pro mask, which is the one I carry in my professional office, just essentially every day, you know, from here to here, to just help, because it's for post, you know, surgical use. It's for open skin. It's for non-healing wounds. It can go right on those wounds. So I mix it up every night, put it on. It helped a lot. So currently it's just all scarred, just, you know, scar tissue, but it doesn't hurt anymore. It was really painful.
Wow. Okay, so let's jump into that aspect. I know that you know, in an aesthetic practice, you carry the CO2 Lift Pro and you carry the carboxy gel treatment and the CO2 Lift V for vaginal rejuvenation. So in your own, so we're not going to talk about necessarily your patients. Let's talk about you. So you just mentioned that you've been using the CO2 Lift Pro on your port wounds, right?
The port wound, the post-surgical mastectomy wounds, the drain wounds, and then this whole big radiation damaged skin wound.
Wow. And comparing, I mean, I know that, you know, you're not an oncologist, that wasn't your thing, but even just, I know that talking with other women, how has the CO2 Lift carboxy gel treatment been helpful in that? I mean, in other words, if you didn't use it, what would be the result? Or
well, there's not much you can put on open wounds, right? I mean, you can cover it with bandages, but most treatments are not for open wounds. You know, you could have a risk of some sort of reaction or infection. This is actually for, I mean, it was in the Journal of Dermatology to help with non-healing wounds, which is essentially when you have radiation treatment, it's kind of like having a diabetic wound almost. It's restricted the blood flow, it's caused scarring, so you've got a non-healing wound. I also did hyperbaric oxygen chamber for the same reason. After the radiation was done, the doctor gave me the green light. This is all to increase blood flow, increase oxygenation, so those wounds can heal. So that's what the CO2 Lift does. It's going to increase blood flow, increase oxygenation, increase collagen formation to help wounds to heal. Also just to improve, you know, the skin after radiation is so contracted and scarred down. And I haven't had my reconstruction yet. So just for those of you who might not know, and I actually didn't because I'm not an oncologist, but they put spacers in. So they don't put implants in right away. They put these things called tissue expanders, also known as spacers, which are pretty painful because they're sewed to your ribs. And then they fill them with water in the clinic. So they are these like water balloons essentially, because if they didn't do that, then you would never be able to get implants because everything would scar and the tissue would contract. So it's basically making a space for the implant to go in later. So it's really important, the collagen formation that the CO2 Lift is gonna help create, because these are damaged tissues. So it's gonna make them supple again and help them come back to life.
that is amazing. We have done a mini study on wound healing, and you know what we found, and we're just now in an extensive one with 20 patients. But yes, the CO2 Lift carboxy gel can close a non-healing wound within really 4 applications on an average. So
right,
pretty quickly, you know. So I'm so happy that you could get relief with that. Wow. Okay. And obviously, you know, even going through that. So for the skin, you had talking about skin on the body, but also skin on the face, because we're all connected. It's all connected. So the dryness.
right.
Going through treatment. How do you feel about using that when you're using it on your skin? For your
So
skin?
it was great because with the chemo, it kills all fast dividing cells, which is why your GI tract is affected. The surface of your eyeballs have these epithelial cells that divide quickly. Inside of your mouth, you get this, you know, stomatitis, this gingivitis, everything is, you know, the hairs all over. I lost every hair on my body. So the skin also gets really dried out. So I would put the mask on from here and I would just go all the way back because I didn't have a hair on my head. And it also helps to grow hair. I mean, whether you've lost hair because of chemo or whether you've lost hair because of your garden variety, just hormonal reasons, age-related effects, the oxygenation, the blood flow, the collagen formation, these are also all going to help grow hair. So I grew my hair extra fast. So for those of you who look back at my my posts from on my Tara Brown MD site, you can see that I was bald and I grew hair real fast, all at once. Like all of a sudden, as soon as my chemo was done, they told me it was going to be months before I'd start to see it. And it's actually almost thicker than it was before, which is really great. So I would just put the CO2 lift all over my head and face and neck. And so it would help keep my skin. Oh, because I'm a, cosmetic surgeon, and I couldn't puncture my skin. I mean, I couldn't even do Botox. And this was hard for me. I couldn't even do a chemical peel. I couldn't do filler, nothing. I couldn't do any RF treatments. So this was all I could do. But it kept, fortunately, I'm going to be 45 next month. So it kept this whole thing intact.
Yeah. Oh my God. You look incredible. Really. And I don't know, for those of you who are seeing her, she looks incredible. I mean, just seeing in real life when I was seeing her, I'm telling you, she looks like she's 12 years old. But yeah, no, that is awesome. It's actually because of your videos, I started using it on my husband's hair because he's thinning.
Cool.
He refuses to see that his hair is thinning. And I'm like, Terry, he's pretty tall. So most people can't see on the top of his head, but when he sits down, so I started, and it actually is getting thicker because of it. So
nice.
it was because of you. I'm like, why didn't we start doing this?
Yeah.
But okay, so let's talk about the CO2 Lift V.
Yep.
Now, one of the things, and I'm very, very, very passionate about helping women to make this conversation very natural, talking about the vagina and aging of the vagina. It's just because of how most of us are raised, we just kind of hush hush, we don't talk about it, but it's a very natural part of a woman, an essential part, what kind of makes a woman. So including this as a part of self-care, we don't have to have something wrong to start talking about it. I mean, you have a stressful day, most people will just put on a carboxy face, but why not put on a carboxy V? It's going to help that area. But let's talk specifically about the challenges, because you're pretty young. What are some of the challenges that you've gone through based on your treatment, and how has that affected your vaginal area and your function and all of that?
So when I got diagnosed, I talked to one of my friends. I went to residency with Nikki, who's a doctor up in Washington State. She's a year ahead of me in the whole breast cancer journey. And as we were talking, she said something that I remember. She said, the vaginal dryness, she's like, of everything, is actually one of the worst parts. And so I see what she means. It's, so it puts you into instant menopause. So essentially I went from I just turned 44, and then I started these treatments, and you go into menopause so quickly that the hot flashes it's hard to describe unless you've had them. I'd be just suddenly pouring, sweat soaking through my clothes, and that's from the lack of estrogen. And then, a few months later, I started to get the vaginal dryness, and I am on these drugs now that I'm done with my surgery, chemo, radiation. When you have a estrogen receptor positive breast cancer like I have, they're not all, but most of them are. You have to go on these drugs either called tamoxifen or aromatase inhibitors, depending on how advanced your cancer is. So I'm on aromatase inhibitors, and essentially it's like a little sponge that mops up every last little bit of estrogen that might be left in your body, because your body will try to create estrogen because it'll sense that there's none. So this will totally prevent that from happening. So these drugs have a lot of side effects. They cause, for example, osteoporosis. So you automatically have to get infusions of the osteoporosis, reversing medications. I'm going to start that next month. But as a result of that, you have essentially, you've gone from being a premenopausal person to an instantly postmenopausal person, and you can't take any of the treatments out there for it, because all of the treatments, even the natural ones, are phytoestrogens in some way, and those are off limits to us. A lot of the supplements that people will take to help with the side effects of menopause, the hot flashes, if you look, they're converted to estrogens in the body, and that's essentially how they're helping. It's just a natural way of taking hormone replacement therapy. So I can't do that. No one with breast cancer that's hormone positive can do that. So the vaginal dryness is a problem. Definitely, it's really difficult to have intercourse with these side effects. So the only thing that I know of that you can do is the CO2 lift V. I talked to another surgeon who's gone through this, who had the same problem, and she told me that she started taking these DHEA suppositories, and I said, isn't that going to potentially get converted to estrogen? And she said, oh, my oncologist is really unhappy about it. But it was the only, to me, it was worth the risk, because otherwise I couldn't have intercourse with my husband. And I said, you know, there is this other thing you should look into. And I told her about the CO2 Lift V, because it's completely non-hormonal. It's totally safe for people with any sort of ovarian cancer, breast cancer, any sort of hormonal related cancer. So as far as I know, it's the only treatment that can help. And it increases the hydration, it increases the blood flow, it increases the collagen. So all the reasons that it's helping, you know, my post-radiation skin, it's also helping the vaginal side effects.
Yes, awesome. Yeah, I'm glad you brought that out. I mean, obviously, you know, it's the CO2 Lift V is non-hormonal, and it's created for so many different women. Just had a baby, you know, you want to bring back blood flow, you want to heal that area after repair.
Yeah.
Women who are on certain medications, because that can cause dryness.
Right.
Medication for depression can cause that.
Yeah.
And just like what you're saying, you're going through, you know, treatment for breast cancer, chemotherapy can do the same thing. And, you know, we often talk about, you know, getting through it, but then what about life after? Right. You know, as your friend was saying, you know, she's willing to risk that because she wants a life with her husband still.
Right.
So this is something that you can take, that you can feel safe about, that will do this very quickly. I mean, so I don't know if this is too personal to share, but we've shared a lot of personal things, but how has it helped you with in terms of that?
It has helped. It's not back to what it was before my breast cancer diagnosis, but at least it's doable now. So I don't know if it's ever, so many things are never going to be the way they were before. I mean, hands hurt every morning because it causes joint pain. I think that's these drugs I have to be on for 10 years. So there's a lot of things that'll never be like what they were before, but obviously, you know, I've been married 18 years. There was a moment where I thought I was never going to be able to have sex again. So that is not the case. So it's helped tremendously. It also helps the area, you know, the vaginal area to look better, actually, and feel better. So for many reasons, you know, you don't have to have breast cancer to want to do it. You could just, like you said, be taking medications for, like there's, for instance, like a lot of nerve pain, your amitriptylines, your nortriptylines, your SSRIs for pain and depression and OCD and all kinds of things like that. A lot of these have, I'm an ophthalmologist and ocular surgeon by training, and I do periocular surgery like lid lifts, brow lifts. So I have a lot of patients who have severe surface dryness of their eyes because of these drugs that they're taking. And so it causes dryness of mucous membranes everywhere. So it doesn't have to just be, you know, some, you know, huge catastrophic diagnosis like breast cancer to make you want to do this. Anywhere that needs moisture and healing. And in fact, I just had a patient call me the other weekend. I've been trying not to work weekends. And she said, I have to have more of the CO2 lift mask, because she had just had a rhinoplasty and was having trouble with healing and nothing was helping. And she had an area of inflamed cartilage. And she said that I had given her a CO2 lift mask after a Vivace RF microneedling treatment. And she just she'd forgotten about it and hadn't used it. And she said she put it on her nose, and it was the only thing that finally quieted it down, quieted the swelling. So I met her on a weekend and just like sold her, you know, 3 of them in this like little drug deal we did. And she said it basically saved her. So any sort of healing anywhere that your body needs, that's what the CO2 lift is for.
Yeah, exactly. I mean, you're talking even allergy medicine. If it's drying out your sinus,
yes,
your cavities, you know what I'm saying? Many people take allergy medications, and so it doesn't have to be something as is catastrophically wrong. You know, I mean, just the thing about it is you don't know, or sometimes you forget. So if you wanted to simply improve the quality of your intimate life, and also too, I know that, you know, we're talking about your experience, but even in this, I was just at a conference this weekend, ISHWISH, which is the International Society of Sexual Health Practitioners. And, you know, it's about sometimes too, you know, very few things that we can do as women. We have very few sexual cues, you know. For men, you know, it's it's, you know, the breeze will blow and, you know, it will, you know, they will get excited, or they can. But for women, you know, we're so in our heads, we're thinking about all the things we need to do. So just simply the act of taking care of that area allows us to kind of get that mind body or mind vagina connection. We're
Right.
expecting, you know, sex to be more pleasurable, and so we're going into it with that expectation. So it's improving the quality of our life just by the fact of that we're taking care of it. And for those of you, a course of the CO2 Live V is either 5 to 10 treatments done weekly, and then you can maintain it with monthly treatments. Some people still do twice a month. Like for instance, someone when they're on medication, like what you're talking about, they may do twice a month. But it's not a lube. It's actually treating the area, just as Dr. Brown was saying, repairing the tissue, and so that it's more sensitive. It's more, so people will experience less inflammation. So even the sensation of having to pee throughout the night, sometimes it's because of inflammation there, and you're getting rid of that. You know?
Yeah,
So,
I definitely had that, and it's due to a urologist friend explained that it's, and again, it could be anyone experiencing low estrogen. It's due to a lack of estrogen on the tissues, the urologic tissues. And then you add urine to the mix, and it feels like putting like a lemonade on a cut. They described it like the tissues are sort of atrophic, and now you add something that's very acidic to the mix, and then it wakes you up, and then you're like, oh, I guess I have to go in the middle of the night. So you know, their treatment for this is just estrogen cream, which again, as we just discussed, is like poison to people like me. So this is a really great solution to that problem.
yeah, in fact, at this conference I was telling you, so one lady who was on estrogen cream for any reasons, but that was one of the symptoms that she had, where she would have to pee 3 or 4 times in the night. And she had bought some of the CO2 Live V, and she said after just the one treatment in the night, she just, because I never even mentioned that to her that would happen, but she came and she says, you know something, I tried it and I went to the bathroom once. So now the sensation to pee really only is triggered because her bladder is full, not because of the inflammatory response.
Right.
So that was very quick in one application. So it's very quickly gets rid of inflammation. So wow, Dr. Brown, this is incredible. I think you're just such an incredible woman. I mean, you have such a great attitude, you know, going through this. And, you know, I think that I hope this your story can help so many women. First of all, just we need to be proactive about getting ourselves treated, whether you do a thermogram or you're doing a mammogram. But even then, just regular breast exam, just like what you did, because here it is, you were doing that. And then just take it seriously, because you don't have, do you have a history? I know, do you have a history of this in your family?
No, I don't have a family history. And so they sent me to the geneticist because of my age, and they did around 50 genetic tests, and they were all negative.
Wow. You see? So when we find this, regular examination is important. And when you find something that's off, don't take it lightly. Just, you want to go and check it out, because you can be, you know, early detection is going to help. As much as though it was just a year before that you did, and it was stage 3, your diagnosis stage 3. That's just crazy to me.
Yeah. Yeah. Unfortunately, yeah, mine spread really fast.
Wow. Wow. So Dr. Brown, what tips would you have, or what advice would you want to give to women, to families going through this? What would be your advice?
You know, a friend of mine who's a psychiatrist, I spoke to her right after I got the diagnosis, basically in the airport when we were about to get on the plane to go on this trip. I spoke to her, and we didn't know, you know, if it was stage 4. We didn't know how widespread it was. And she said, just, if I can tell you one thing that you're going to remember, it's just to be here now. So don't think about the future. Just think about, you know, the chair you're sitting on, and how, you know, the sunshine and your family, and just try to be in the moment. And that's just really good advice, I think, for everybody. Sometimes we get ahead of ourselves in our head and we don't appreciate the moment. So I try to live that way now. And because otherwise I think I would be in a state of near constant existential dread, worried about, you know, what any of my future scans are going to show. And so I just have to kind of make peace with everything and live in the moment.
I think that is such, and we're getting some of the feedback, such great advice. You know, we were talking the other day, and you know, any one of us can just cross the street and get hit down by a car. You know,
Absolutely.
and, you know what I'm saying? So we really need to be present and be really live in gratitude for the moments that we have, and because no one is promised tomorrow. You know, so we just live in a way. If we make every day the best day that we can, then we're creating a trend of that. Then tomorrow will be great, and tomorrow, so we don't have to think so far off. I mean, we have to obviously plan, but we don't want to be focused on living in the future like that. So I think that's such great advice.
Yeah, you know, now talking to her more recently, I told her it came up that I think about death every single day. And not to say that in a negative way, actually, almost like it's a companion. And she said, you know, other cultures do, but Americans don't. It's kind of a taboo topic. They don't really talk about it. They don't think about it. And I said, yeah, that was me before I got this diagnosis. So in some ways, it's actually kind of healthy to always have a relationship with death because it makes you appreciate life more.
Wow. Yes. Yes. It's so true. Oh my gosh. Wow. So some people are asking, they're just joined, and this will be posted. We're going to save this video and it will be on both of our pages. For those of you who are not following Dr. Brown, she is an incredible physician, an incredible individual. She is at Dr. Tara Brown, right? At Dr.
It's Tara Brown MD is the
Sorry.
Instagram handle.
Instagram handle, Tara Brown MD. Tara Brown
Yeah.
MD. Please go ahead and follow her. She has, for those of you who are close to her, look her up. You'll see where her practice is located. Check her out. She's, again, an incredible surgeon, an incredible physician. Also, she's offering a code for a discounted amount on the CO2 Lift V. If you're not near her office, you can go to the co2liftv.com. You order, and if you put in the code Dr. Tara, you'll get 15% discount, right? On the CO2 Lift V. So for those of you, but also too, for you're interested in the CO2 Lift Pro, she has it at her office. I just really, really thank you so much for sharing your story with us and just spending some time with us today. Thank you so much, Dr. Brown.
It was my pleasure. Thank you.
Thank you. All right, everyone, we're going to sign off. Thanks for joining all of us. We will repost this on our page. All right, thank you. Bye-bye.
Thank you.